Okay, let's have a class, and we'll have an exam 2 next week, Tuesday. So some suggestions. This is going to be a bunch of bacteria name with case study. So what I suggest is absolutely this practice exam you have to do, and over the weekend, you and your friends can grab together in the library, have a cup of coffee, or even maybe have a cup of beer, and then you ask everybody, learn from each other, and to figure out all these bacteria. Okay, you can say, oh, alpha hemolytic, gram-positive diprococcal, catalyst negative, optic sensitivity, what's the bacteria it is? Then other people, well, we can say, oh, Streptococcus pneumoniae. Then that's a way to review. It's more efficient compared to yourself. So you know what I'm saying? Work with your bench partner in the lab or your friends, couple people in the library, or find a private area, maybe some girls with some boys, then study together. It's more efficient because it's all the passages related to this case study. Okay, so today we're going to go over these. So exam format will be similar to this, which means at the beginning, we gave you all the bacteria names. So you don't need to remember the spelling. You only need to know their name. And we have A, B, C, D, E, F, G all the way. And then we have a case study. It could be long, it could be short. Based on the story, especially the characteristics of the bacteria, then you pick the one best fit. I usually only one. But here's the one thing. The passage may be repeatedly used. So which means, let's say it's A. You cannot cross A and say, oh, it's already gone. You're going to have to pick from B, C, D, E, F, G. Does not necessarily mean that. The passage could be repeatedly used. Okay, so that's something to keep in mind. Now let's look at these case studies one by one. So the first one, John, English instructor, received a call from adult daycare. 74-year-old mother was staying. Okay, that's an older lady. She was experiencing chest pain, chills, and fever. So what is that? Chest pain, chills, and fever. Possibly the symptoms of pneumonia. So he arrived at the daycare. She seemed to be short of breath, and the cough, well-breathed and cough, hard to breathe cough had worsened and become productive. The local hospital prepared sputum sample which grown blood agar and chocolate agar, producing alpha hemolytic. So here is very simple thing you do. Chest pain. Okay, you have a fever, you have a cough, an alpha hemolytic on blood agar. That's the information. And then we have gram stain. Find the gram-positive diprococcal. And catalase test negative. We just did it. We did today in the lab. Catalase test negative. That's why I want you to do the clinical lab. Then you are feeling about what is catalase test negative. Optican test sensitivity was conducted. It was sensitive to it. So remember, that's optican is a component of what? A P disc. Which pathogen it is? Streptococcus pneumoniae. So this will be you right in the corner right here about this important information for this pathogen. And on Saturday, ask your friends, tell me what you know about Streptococcus pneumonia, alpha hemolytic, gram-positive, diprococcal, catalase test negative. So why is catalase test negative? If it is positive, that could be Staphylococcus, because catalase is the easiest one to differentiate Streptococcus and Staphylococcus. This is P disc is optical. So, which means susceptible or sensitive, that is Streptococcus pneumoniae And on the other side is resistant. What's that? That's Viridian strep. And this is what throughout culture I said. You guys do not pick from the teeth, because if you from the teeth, what will happen? You get lots of the Viridian streptococcus. The blood agar looks terrible. Okay? And then you have this. Then don't forget what we talk about. The A disc. A disc, the components is we call basic tracing. Okay, then we talk about this basic tracing. We just mentioned about the mechanism behind it. What's that? It's prevent the precursor material to traveling into the cell wall system to let the bacteria building cell wall structure. And look at the figure. We're going to get to that. So these are the knowledge you connected from P disc go to the A disc. Then A disc, what they do? Group B Streptococcus agalactia and strep and GAS. Is that right? Pyogenes. Then what means GPS? What is GAS? Then go ahead to learn this knowledge. That's what we call review. Okay, so one question you could dig a hole to study lots of the others. So that's the first one. Second, when you read this, 4-year-old boy, that's a kid, less than 5-year-old, headache, tough neck, sore throat. Well, possibly stiff neck. I mentioned that this is a very typical symptom for meningitis. And people doesn't realize it. Fever, sleepy, chest exam, radiation normal, but decline mental status, history, headache, and photophobia, scared to the light. Okay, then a gram stain, what they find? Cerebral spinal fluid, blood agar chocolate find it's only grow on chocolate agar. And then run the XV test. What is that? Hemophilus influenza. Okay, so second answer is Hemophilus influenza. When you know Hemophilus influenza, gram-negative Coccobacillus, okay, fastidious bacteria. So only chocolate agar. And we have a vaccine for that, HIV, type B. And what are the symptoms for the meningitis? They go ahead and study. That's how we do it. And very important, only grow surrounded X and V. What is X? I mean, what is V? Nicotinic dinucleotides. Okay, that's the information right on the side of this case study. So, Hemophilus influenza. Next one. 27-year-old female office experienced a sudden onset of dizziness while at work. Carried to co-worker's car and began to vomiting and a severe headache, muscle aches, and nausea. The lady was taken to the hospital where her condition worsened. She claimed she had not feeling well all the morning. That's a little fever, 103. She developed a rash and experienced a sudden drop of the blood pressure. It's like a cold shock. So if you have a suddenly drop of blood pressure, that means like a shock. Okay, and it's 27-year-old lady. So, blood CSF negative for sepsis, bacterial meningitis. He was experimenting using a new contractive sponge that has not been removed since the previous evening. So, woman had shock-like symptoms during the period of time, it looks like. What's that? Staphylococcus aureus. So that's when we talk. So then go ahead to study what is Staphylococcus aureus, the gram-positive. These are ED gram-positive, coccell, grape shape. Okay, what are we talking? We talk about food intoxication. We talk about. We talk about MRSA, MRSA, methicillin-resistant Staphylococcus aureus. We talk about PSST1. This is the one we have to mention in this case study. And this is also a beta hemolytic. And this is also yellow corneous on mannitol soft agar. So these are the things we recorded. Then you know what are they. And then once you finish the Staphylococcus aureus, go ahead to think about the Staphylococcus epidermis. And go ahead to Staphylococcus saprophyticus. And this is, you absolutely know, it's called honeymoon bacteria. And that's all the other information you need, okay? Number 4, a gram-positive coccell was isolated from 37-year-old female urinary tract infection called a UTI. Laboratory tests indicating organism or blood agar with no hemolytic zone, catalyst test negative, and the Rebecca Lansfield group D. So this is the one. Go back to study Lansfield group. What is A? Pyogenes. What is B? Streptococcus agalactia. What's the last one? Enterococcus facilis. So the answer is Enterococcus. And if you see Rebecca Lansfield group D, you should know this is Enterococcus facilis. It's already been talked about that. 22-year-old sexual activity female comes into the student health clinic complaining of painful and frequent urination. The terminology called dysuria. We'll have a lab to do that, the urinary test, to see the bacteria. The technician spun down her urine for microscope observation and find a gram-positive coccell grape shape. Gram-positive coccell grape shape. Further testing reviewed the organism was catalyst tested positive. Of course, it's Staphylococcus and resistant to novel bowsing. And I tell you a joke. Why the mom will know the lady has been out home for a couple months, couple of days, honeymoon bacteria. Why that can do a quick test? Because it's resistant to low dose novel bowsing. So what's that? Staphylococcus saprophyticus. And the nickname is honeymoon bacteria. Okay, next one. 29-year-old pregnant female elected to have homeborn. Okay, this is a homeborn with a midwife. Not happened in the US all the time. Happened in the old days. She chosen to have little medical intervention and delivered a healthy 7-pound baby. On day 5 postnatal, the baby was experiencing tremors, vomiting, and tachycardia. Abdomen, rapid heating of the heart. He refused to breastfeed and had a fever. His urine, cerebrospinal fluid, and blood were cultured. The blood culture and CSF came back with gram-positive. Catalyst tested negative beta hemolytic. This isolate was resistant to basic tracing. We just talk about here. And we also talk about the gram-positive, catalyst tested negative, beta hemolytic. So what's that? That's Streptococcus. And it's resistant to the basic tracing. We compare the GAS and the GBS. Of course, it is GBS. Now, why we know that? It's a newborn baby. And the woman at 37 weeks failed to do a screening test. The newborn baby could have meningitis or septitis or pneumonia, and that's a typical symptoms. So this is Streptococcus agalactiae, group B Streptococcus. Question number 7. A Honduran mother and her 5-year-old crossed the U.S. to atop a freight train of Mexico, but were upheld by U.S. immigration authorities. Again, this is just a case study from CDC. I'm not anti-immigrants, okay? So don't make a big deal. This is a case study from CDC to study for the passenger. So I have to mention about these days. Shortly after being placed in immigration detention, the boy developed a sore throat, difficulty swallowing, and the onset of neck swelling. A blackish gray membranes, exudates, and throat swab find gram-positive club-shaped arrangement, and on the blood agar with terrorite. They can cultivate cultivation. And the patient history was significant in that he had not received the childhood vaccination, which is what is this one. So we draw this all the time. Swelling neck. Okay, in the tonsil area, you see the pseudo membrane. And this bacteria is gram-positive, club-shaped, large. And it's had this for protection. And the kids did not do the vaccination. So what is that? Corynebacteria diphtheria. That's a very typical one. That's the first one we mentioned. So, swelling neck, the lymph nodes is swelling, blackish gray membranes exudates, gram-positive club-shaped arrangements can grow on the blood agar with terrorite blood agar. It's a transport media, and we have a vaccine for that. It's DTaP. So, diphtheria, Clostridium tetanus, acellular, and the Bacteria pertussis. So that's one shot for 3 drops. So that's a very good example for Corynebacteria diphtheria. So that's why I ask you guys in the morning when you see the lards, that could be Corynebacteria. It's going to be Corynebacteria species, not the diphtheria. It could be the species. I don't think you're going to have a diphtheria. It's a Corynebacteria SPP if you see the lards there. Did you feel about it's a club shape a little bit? Okay. Then it's up to you. I mean, I didn't see it. I just want to ask. From your pathogen list, which organism is the most post-surgery infection belonging to a group of antibiotic resistant, known as MRSA? That's easy. Staphylococcus aureus. That's why you have to write down these. Sorry, right here. MRSA, Staphylococcus aureus. In Yavapai County, Arizona, this is the border. Okay, when you see Arizona, that means it's a border state and possibly is related to immigrants. A 13-year-old boy in the 8th grade was culture confirmed positive for pertussis and had attended the school during his illness. To identify others who may be affected, a probable clinical confirmation was established for the other students in that middle school. What are the criteria for clinical confirmation? So pertussis, what is that? Yeah, Bacteria pertussis. So when we mention about how we going to do the diagnosis, we have the nose, and we have the ear. How we do it? Nasopharyngeal cotton swab. It's not really the cotton swab, it's a Decorin swab. You should be inserted into the nose about half distance between the earlobe to the nose. Right? This will be the depth. So, what this should be. And followed by PCR test. Positive polymerase chain reaction of the nasopharyngeal specimen. Okay, so that is for purposes. Then what's a pathogen for that is body-terror purposes. But here is asked you to pick from A, B, C, D, so the answer is B. The culture-based screening method for the prevention of systemic GBS, Group B Streptococcus recommends. I already said, screening pregnant woman for vagina or rectal GBS between 35, 37 weeks of gestation during the pregnancy, later stage of the pregnancy. This is I already said. The approximate distance you should insert a nasopharyngeal swab is half distance from the nose to the earlobe. So the answer is C. That's what I said. One review flashcard could answer multiple questions. And everything you should write down on these empty area and ask your friends over the weekend. From the pathogen list, which organisms are now considered a part of the United States recommended childhood immunization schedule? This one, you need to go back to see your slides a little bit. So we go all the way back to the exam 2 lecture 1 slides, and I had one very important information which is supplied here. If you forget about this one, you need to go back to the slides, look at this guy. That is a sketch what we have. So DTAP is right here, HIV, PCV, those are the one we have. And you can see, so you go back to see, look like the A, what is A? Streptococcus pneumonia, this is PCV vaccine, we had it. And let's look at the one, so D and B are gone, then look at the L, we just pick someone. Staphylococcus saprophyticus, we don't have that one. Of course we don't have that vaccine. I already said it's sexual transmitted disease. If that one you have a vaccine, it will be a breakthrough. So we don't have that one. So L is gone. Imagine if you can have that one, you give a shot, you can do whatever you like. That's I always say the joke. So that's a social science versus medical science. Okay, so Staphylococcus saprophyticus, there's no vaccination for that. M, both had M, so we can skip that, but let's double check. Haemophilus influenza, yes, HIV virus. Type B, Haemophilus influenza virus. Vaccine, we have it. The other one, let's say O. Let's look at the O. Where do we have it? Corynebacterial diphtheria, yes, we have it. Bordetella pertussis, we have it. That's DTAP. So the vaccination here is C. Okay, that's all the microorganisms, we have a vaccine for that. Next one. Which etiological agent, that means a pathogen, is responsible for childhood peritonitis, tonsillitis, sinusitis, otitis, and superactive skin infection with sequela? We call it rheumatic fever and glomerulonephritis. If you forget about this, then you're also going to go back to see the slides. In the slides, we talk about that. Streptococcus pyogenes, post-streptococcal disease. We write there glomerulonephritis and rheumatic fever, which means even you recovered with Streptococcus pyogenes, you may still have the problem. So that is the Streptococcus pyogenes. So the first set, we are done. That is how we review. You're not going to be on Tuesday morning, grab a bread and just look at it and say, oh, this is A, this is B, this is C. That's not the way to study. The way to study is at least to start from the weekend, write down the flashcard, all these characteristics, and study each of these cases. And one case can be applied to be lots of the other questions. Okay, so this is the first one. So let's look at the second practice questions. The second practice question is a little bit easy. I would suggest you, if you haven't been really studied, do this set of questions first. This really helps you a lot. One question you don't have to do, I'll mention. Same thing, at the top we have bacterial pathogen name, then we have these statements. You should pick the pathogen fit set. This is much shorter, and it's not a story, it's a much shorter statement, so it's easy. Can grow on bioacetylene agar and hydrolyze the carbohydrate acetylene. Which is that? Enterococcus facilis. Remember, this is resistant to bile salts, 6.5%. Grow on bioacetylene agar. And because acetylene reduced to acetylene, therefore it is black colonies. And of course, the black colony will be faded. The reason is it's going to be reduced back to the original status. So that's Enterococcus facilis. Second one is easy. Can produce toxic shock syndrome by elaborating a toxin referred to TSST1. Right here. Staphylococcus aureus. Pathogenic forms of may produce beta hemolytic and enzyme coagulase. Okay, then you need to add it. Staphylococcus aureus. Coagulase test possible. So how we did that, remember we talked about, this is a rabbit blood plasma. Saline solution. Okay, we inoculated Staphylococcus aureus. And then what we do, we flip it over. And the liquid will be glued here. It's never going to be taking out flee away from the tube because the coagulase can coagulate the blood cell, makes it like a glue. So that's coagulase test positive. Catalyst test negative. Gram-positive cocktail belonging to immunology group A and susceptible to the basic tracing. We already know GAS. Pyogenes, Streptococcus pyogenes. We already know that. Okay, so that's easy. Alpha hemolytic gram-positive cocktail. Catalyst test negative. Sensitive to bile salts and other surface active substances such as optican. Alpha hemolytic sensitive to bile salts and others such as optican. Then Streptococcus pneumonia. A gram-positive cocktail that is catalyst test positive, or possibly Staphylococcus. Coagulase test negative, so not Staphylococcus aureus. Resistant to low concentration of novel bacillus, then it's honeymoon bacteria. Staphylococcus aureus. Right here. Can grow and ferment Macanthi agar. More than one answer. Okay, this is a little trick. So that means it needs to be gram-negative bacteria. E. coli is one of that. What else? Klebsiella pneumonia. So if say you forget about this, then we let's go back to see the slides. Let's say you forget about that. Klebsiella pneumonia. Klebsiella pneumonia on the right side is a very sticky colony. We call it a mucoid colony. It's a blood agar growing. On the left side, what you see is a Macanthi agar. It's pink, lactose fermentation positive, and also you see it's very sticky. It's a mucoid colony too. So that's lactose fermentation positive. So the answer here will be Klebsiella ammonium and also the pneumonia and also the E. coli. Both could be there. This microorganism can grow on selected media containing 7.5% salts, does not coagulate rabbit plasma susceptible to novel bacillus. Then what's that? That's a little bit of trick. 7.5% short. It's Staphylococcus. Staphylococcus is what? Is a healthy. Don't forget. Sort like. That's Staphylococcus. Okay, then what you see? Does not coagulate rapid plasma. So it's not Staphylococcus aureus. It's susceptible to novel Belsing. What's that? That's epidermis. Okay, that's epidermis, Staphylococcus epidermis. Because when we study Staphylococcus, we only do 3. Staphylococcus aureus, that is not. Because Staphylococcus is coagulated rapid plasma. Saprophyticus is not, because it's resistant to novel Belsing. Well, which one left? Is Staphylococcus epidermis. It's a normal bacteria on the skin surface. Number 9, belonging to a group of alpha hemolytic microorganisms that normally live in the upper respiratory tract and may cause opportunistic infection. Okay, then this is being a little tough. Cause opportunistic infection. It's a normal bacteria. And if you change the condition, it will be traveling to cause disease. It's alpha hemolytic. So what is that? That's Veridium streptococcus. It's a little bit difficult. Veridium streptococcus normally live in the upper respiratory tract. Oral tract is one of that. May cause opportunistic infection, like oral surgery, could develop, become endocarditis. It's alpha hemolytic. Gram-positive endospore forming found in the soil. Which one? Bacillus subtilis. That's the only thing, because we don't have a cross-reading here, so Bacillus subtilis. So that is right here, 11. The gram-negative blood grow rapidly on blood and chocolate agar. Mucoid colony fermentation lactose on Macanthi agar. I just said it. Just to show you, that's what it is. So Clabacilla ammonia. Fastidious 12. Fastidious gram-negative blood will only grow on. I didn't teach that one. You don't need to worry about that. I didn't talk about the BG agar. You can skip question 12. Question 13. The etiological agent of whooping cough. Bordetella pertussis that causes whooping cough. Gram-positive blood that forming palisade arrangement. Another type of club shape. So, monobacterial diphtheria. Gram-negative blood that grow on chocolate agar, not on blood agar, so which means it's a fastidious bacteria. Usually causing meningitis and epiglottitis in age 2 months to 5 years old. Haemophilus influenza. Okay, since we mentioned Haemophilus influenza a couple times, you should be familiar with this chart. What are the meningitis pathogens correlated to each age? 0 to 2 months, group B Streptococcus agalactia. 2 months to 5 years old, type B Haemophilus influenza. 5 year to 40 year old, Neisseria meningitis. Older people more than 40 years old, streptococcus pneumonia. That is each pathogen correlated to the age. So when you study this, go ahead to study that chart. Okay. Next one. Responsible for the toxigenic disease that produces a thick greenish pseudomembrane in the back of the throat and the lymphadenopathy known as bull neck. Well, we already said. Corynebacterial diphtheria had a bull neck, already drawn there, and the pseudomembrane. The HIV vaccine for this pathogen, what's that? Haemophilus influenza. That is called a type B Haemophilus influenza. This is type B. This Haemophilus influenza. HI. That's why HIV. Okay. Type B Haemophilus influenza. The DTaP vaccine contains a toxoid to prevent which pathogen from causing disease. Okay, that's easy. D. Corynebacterial diphtheria. Clostridium tetanus. There's not here. And Bordetella pertussis. Okay, N and O. A gram-positive catalyst negative coxa belonging to Rebecca Lansfield group D. Enterococcus facilis. Right here. We already did. Last one, can infect the skin and cause impetigo, deep cellulitis, sequelae following active pharyngeal infection, including rheumatic fever and glomerular nephritis. Well, that's already talked about. If you forget, Streptococcus pyogenes. It's the slides tells you lots of information. So this slides mark it 3-star, and you should study it. Is that right? And you can cut it and even put on the back of this case study, then you can study this one. So exam 2, this section you should review first. Then you go back to do the other case study. Okay, what we left, what we haven't talked about is another set of the study. Okay, is a practice 3. This will be a little bit different. But let's go over those questions first. And one section I haven't lectured yet, but we're going to do that. Let's go ahead to do the case study first. Again, lots of them on the top list, then we have a case study. But there is a one big chunk of the pathogen we haven't talked, is Clostridium. So that's why there are some questions related to that we're going to be studying. So let's look at these. On June 22nd, 4 people attending a cookout fundraiser for local JC hospital 24 hours with difficult swallowing, double vision, and slurred speech. That's neurological symptoms. Okay. Many patrons of the event recall some level of the mild stomach upset in the late evening of the event. It is significant to know that many of the dishes were prepared by locally from home canned foods. That's a key information. Laboratory data from foods served as an event demonstrated gram-positive subterminal endospore anaerobically from a canned yellow tomato dish. That's important information. So which pathogen is this? Which pathogen is a risk for home canned foods? If you forget, let's say you didn't remember, that's very normal. So what we do, we go look at the slides always. Okay, then we look at the slides. They are going to be the lecture 2 slides. What are the foods there? Canned food on the top. So Clostridium botulinum. And this is a typical story for Clostridium botulinum. Home canned food, Gram-positive subterminal endospore, and anaerobic. Remember, Clostridium have a 3 important characteristics. It is gram-positive, large endospore, and streak anaerobic bacteria. Related to home canned foods, associated with that, the symptoms is neurological symptoms. So, difficult swallowing, double vision, and slurred speech. That's the first one. Next one. June 1570, young female was in a normal state of good health where developed a fever. Okay, a fever for several days. She has no localizing symptoms except for develop a large circular rash on her back. Okay, that's a very good one, typical one. Her history was notable that 3 weeks earlier she had spent a weekend camping and biking on the trail in the Mammoth Cave National Park. Do you know where it is? It's in Bowling Green, Kentucky, 65 miles north Nashville, Tennessee. Her blood was cultured unsuccessfully, but presented with an antibody type of 32 against typical spiral sheet disease. That's a spiral sheets. That is endemic for that region of the United States. The technician decided to view the blood specimen under dark field microscope. What is the pathogen? By the way, if you future studied in UK or University of Louisville, you can drive there. It has a fun. It's a very good place. Very good place. They have like an 8-hour deep caving trips there. You can be there the whole day if you like. Okay, so what happens? Spiral sheets, circular rash, using dark field microscope, circular rash. What is that? We just talked. If you forget, go back to look at the slides. And we have the slides for that. We go down. So here, if you forget, we talk about sexual transmitted disease following that. A rash. So Lyme disease. Now you're going to figure out which pathogen causes Lyme disease. Borrelia burgdorferi, and it's a spiral sheets. Asexual filaments. Look at that. So that's why these slides is important. You should go over. Okay, next one. During the month of June 2010, the Kentucky Warren County Health Department identified 31 persons had diarrhea. With 10 days of visiting a beef cattle, Operation Warren County. You don't have to do this one right now. I'll do it later on. Hemophilus, hemolytic uremic syndrome, McConkey agar, that's E. coli 0157H7. We'll talk about in the exam 4. Okay. When we talk about the foodborne pathogen. So we can skip that one at this moment. 60-year-old male was admitted to the hospital. 5 days after post-stat surgery, complaining of dysuria. A qualitative quantitative urine culture was obtained by review E. coli in significant numbers. So what they did, 7 days course of the cephalexin. This is the upper level of penicillin. The urinary tract infection improved that the patient later experienced multi-water loose stool, cramping, abdominal pain, dehydration. They did the AB toxin and returned positive. The patient was diagnosed with pseudomembrane colitis. All these are important. That's an AB toxin. That's a 7-day course of the cephalexin. Was unsuccessfully treated with typical antibiotic therapy. A fecal transplant, let's say that is have to do because it's an important case, but it sounds horrible, was performed and the patient recovered in 24-48 hours. What's that? Clostridium difficile. 7 days using antibiotics intensively. It's AB toxin. Typical symptoms, pseudomembrane colitis, and unsuccessfully treated using antibiotics therapy. What are the antibiotics usually they do? is vancomycin. Remember we talked about that for the penicillin section. So this Clostridium difficile. Okay, let's see the next one. A blood agar following an anaerobic system. Okay, and what we find here, from the patient that has gas gangrene and the double beta hemolytic. Double beta hemolytic, what's that? Clostridium perfringens. Clostridium perfringens cause gas gangrene, are very typical. Question number 12, you don't have to do this one yet, because I'm going to talk about this in the exam 4. This is a 6 additional serotypes of pathogenic E. coli. That's called the non-0157 Shigella toxin general E. coli. We're going to talk about that later. Oh. Okay, next one. Couple of things we're going to talk about related to the penicillin. So here are some of the antibiotics. Here are some of the questions help you to study. Who is credited the discovery of penicillin? Well, of course, Fleming. Chemotherapeutic agents that are natural products of microorganisms are most specifically referred to. That's antibiotics. Is that right? Chemotherapeutic agents that are artificially produced are most specifically referred as antimicrobial agents. Because antibiotics are naturally produced, artificially is antimicrobial agents. The lowest concentration of the antibiotics that prevent growth is minimal inhibitory concentration, and also this E-test. Okay, this we need to go back to see the slides. We haven't finished talking about here, but we are studying, we are reviewing, so I'm going to talk about a little bit here. How to answer those two questions. Okay, right here. So this is going to be a little bit of lecture, and we can answer this question. So we talked about antibiotics. We talked about therapeutic index. The index is toxic dose divided by the concentration of antibiotic dose. We want this dose the higher as possible. We want this dose the lower as possible. And how low it is, we need to reach microgram level. Therefore, we need to determine this guy. We call minimal inhibitory concentration. Now, how to determine that? There are 3 methods we can do. Number 1, Kirby-Boer test. This is a disc dispenser test, which means every disc has antibiotics with certain level, and we put in agar plates which is already covered with bacteria, and then we go ahead to see the transparent zone. We will do this in the lab, so I skip it here. Okay, we probably not going to test you in the lecture because we're going to test you in the lab and we're going to practice. This machine is almost like $1,000, and that disc is also expensive. One piece is about like $5 to $10. So we will do the pairs in the lab for Kirby-Boer test. The second test is called the E-test. That is what I have a question for that. What is the E-test? Which means on the agar plates. We're going to add the bacteria there. And then we put a, they're called E-test strip. And it's containing antimicrobials and or antibiotics. And the antibiotics concentration is usually, let's say, 1024, 512, 256, 128, 64, 32, 16. It's decreased by twofold. And then you will see after incubation, it will have an area which is transparent, which means nothing. That means the bacteria is being killed. And then you're going to find the number in the intersection. That is the E-test. So E-test will give you a number for minimal inhibitory concentration, but it is semi-quantitative. That is what the E-test is for. And the Kirby-Boer test also tells you a number. It's also semi-quantitative. But if we really want to know the minimal inhibitory concentration, we have to do twofold serial dilution, very similar to do what we did for spread plating. So you had a control, no bacterial growth. Then you diluted your antibiotics from 16 all the way reduced by twofold. And of course you need to have a control. So why we need to have this negative control, no bacteria? Which means your antibiotics are not contaminated. Why we need a control here for the positive one, which means only bacteria, no antibiotics? Because we want to make sure the bacteria is growing. So think about that. If the bacteria is not growing, there's no meaning to do these tests, because any type of antibiotics you put it there, it will be negative. And then once we prepare these, we add microorganisms there. So for example, we add Staphylococcus. And then the tubes, we're going to do incubation. And after incubation, usually 24 hours, we need to find the first tube, which is transparent. That is minimal inhibitory concentration. And this is quantitative test. Minimal inhibitory concentration, every patient, when they do the treatment of the antibiotics, you should do it individually. The reason is, every specific bacteria in the human body is different. So those are the ways we determine MIC. We have a semi-quantitative and we have a quantitative methods, which is a dilution test. So we can go back to answer this question. The lowest concentration of an antibiotic that prevents growth is called minimal inhibitory concentration. Why we do not say minimal lethal concentration? This is the one. We don't have that terminology, first of all. Second, this means you're killing the bacteria. Inhibitory, which means you only prevent growth. Bacteria is still there. Okay, so that's why the answer is A. Next one. The E-test. Rapid serological testing, of course it's not. Used to quantify levels of IgE, of course not. To measure SQ level, no. It's a quantitative antibiotic sensitivity test. Use plastic strip impregnated with an antibiotic of interest. So the answer is B. Okay, that's what I just explained to you. What is the E-test about? The most selective antibacterial agents, that are those that interfere with the bacterial cell wall. This is because it's very easy. Bacterial cell wall have a unique structure, not found in eukaryotic host cells. Okay, since we'll talk about that, I will have an extra question, extra point of question to answer that. If you know, we talk about the penicillin already, the development of the penicillin and the brief mechanism behind it. I'll have some related extra points for that. Okay, so this slide, please do study, and do study the penicillin's history, what it goes. Okay. sulfur drug. This one I will mention later on. So here we have a question, we can do it. But anyway, we're going to mention again during the exam 3. That's a sulfur drug. So do you know sulfur drug? What's the story behind it? You know that. Bacteria must to synthesize folic acids. If they synthesize folic acids, because folic acids cannot take it from the outside. They have to be generated by themselves, need the enzyme, which is called the PABA. It's a precursor material. And the sulfur drug and the PABA looks exactly the same. The only difference is the sulfur amino base replaced with the carboxylic acid base. So their morphology looks very similar. Therefore, the enzyme, instead of connected with PABA, they are connected with the sulfur drug. So the morphology is changed, and then you cannot generate folic acids, and the bacteria are going to be inhibited. Okay, so that's the principle behind it. We will mention it again. That's why I didn't spend too much time. So the question here is, sulfonamides and other drugs that inhibit the folic acid synthesis have a high therapeutic index because human does not use folic acids. That's not right. Human does not synthesize folic acid, but obtain it in their diets. Humans synthesize folic acids by a process that is not sensitive to sulfur laminates. What is the best answer, do you think? The best answer should be C. Okay? Vancomycin. This is what we talk. Inhibit transglycolysis reaction in the peptide glycol biosynthesis. No, we never heard about that. Interfere the action of the lipid carrier that transports peptidoglycan across cell membrane. Now, I didn't mention about this at all. Inhibits the transpeptidation reaction in peptide glycol biosynthesis. Blocks the addition of the during peptide biosynthesis. Which one? That should be C. Transpeptidation reaction is inhibited. But they are inhibited is the substrate. Penicillin is inhibited, the enzyme. The enzyme called the penicillin binding protein. Okay? Or the top one. Okay, let's look at this one. How are we going to do it? So, this goes here. We're going to do a little bit of lecture. So, we talk about inhibitor cell wall synthesis. We're spending lots of time. Beta-lactam drugs, vancomycin, and bezitracin. This is the sum of the antibiotics, they inhibition protein synthesis. And they are either attacking the ribosome 30S and 50S subunits. But because human being has ribosome, so more or less these will have side effects. For example, the yellow teeth, for example, the hearing loss, or even damage the immune system. So this question related to that, you could be to figure out which one is which. And I'll just post the answer later on, okay? Now we also can inhibit nucleic acids. Let's say rifampicin, let's say fluoroquinolones. We wanted to say that inhibit nucleic acid synthesis is the least effective way. Because bacteria has lots of the bypass and lots of the mutations will be generated. And this is usually for lab strain. When they're resistant to certain antibiotics, you can differentiate your inoculated pathogen compared to the natural existing on the food products. So just want to let you know they could inhibit the nuclear synthesis, but least effect. This is sulfur drug. Cell membrane integrity. This one is usually used is on the skin surface. The typical example is ornament. The product's called ornament. If you have an itching on the skin, you put a couple of drops. That is the inhibition cell membrane integrity. This is not used for the oral take. Okay? So, this is the conclusion. With the cell wall, nucleic acid synthesis, cell membrane integrity, metabolic pathways, and the protein synthesis. You can go ahead and read and figure this out by yourself, and I'll give you the answer tonight, and you can check your answer. Okay? Something else. What's 3 types of the botulism? Food, wood, and infant. Chloral. How we do the treatment? We lose lots of water, so rehydration. Why are many diseases not treated with antibiotics? Well, because they're destroyed by the acid of the stomach. Those who may be going through Shigella, who is the Shigella infection? Daycare kids. Is that right? They go everywhere, not wash their hands, so the children in daycare center is the one. Streptococcus mutans. Dental decay. I didn't talk about this one too much in this semester because of time limitation for that. Streptococcus mutans on the teeth. So what happened is the teeth, usually we eat something like the diets, like the sugar. The teeth environment or oral cavity is usually microanaerobic or anaerobic. So what happened? Fermentation will happen. Once the fermentation will happen, what type of thing will generate is acid. So then the animal will be breakdown. And one of the bacteria is responsible for that is Streptococcus mutans. That is a group of Viridium streptococcus. You can look at your slides. We have the slides for that. Let me show you real quick before we finish. The Streptococcus mutant slide should be here. At the very end of the slides, we talked about this sucrose and the plaque formation. And this is explained to you why the decay will cause. And the pathogen is Streptococcus mutans. They almost like feel the biofilm on the teeth surface. And during the anaerobic environments in the teeth, you have the sugar, you more or less take something, so glucose, sucrose, and the fructose, they go through fermentation, generate acid. And the acid break down the animal, which is called a decaying process. Okay, so that's a good question for you to study. Wrong. Lyme disease spread human by what? Ticks, yes, not a mosquito. Principles for the chloral CAMP created. We have a slide for that. That's the principles for chloral, how they get it. Okay. We've talked about the decay already. Botulism, tetanus, the difference, do you remember? We already talked. Botulism and the tetanus toxin. You can just paste the picture there and then print it to study. That's what's the difference between botulism and tetanus. We talk about that. What's food infection, food intoxication? Food infection is you're eating bacteria. Cooking can solve the problem. Food intoxication, you're eating the toxin. It's usually the toxin is heat resistant slightly. Okay? So that's all we have. So I'll post the key this evening to tonight. Then you can study over the weekend. Okay, that's all we have.